Hello everyone, today we're going to talk about uterine cancer. Have you ever had vaginal bleeding or an abnormal result of the Pap smear? This can sometimes be an indication of a uterine tumor, which necessitates further investigation. When a woman is pregnant, the uterus, also known as the womb, is where the baby develops. Endometrial cancer is a tumor that starts in the uterus. The most frequent sign of endometrial cancer is abnormal vaginal bleeding, which can range from watery blood-streaked flow to a more bloody flow. Vaginal bleeding during or after menopause is frequently an indication of a problem. In this video, I will go over everything you need to know about uterine cancer, including risk factors, symptoms, and how to identify and treat it. Today we have Doctor Bae, who is a leading doctor at Hanyang University Hospital. He's going to discuss with us everything about uterine cancer from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So, is uterine cancer and endometrial cancer the same thing, or is it different?
They may be considered to be similar or different, but uterine cancer includes endometrial cancer, so one includes the other. So within uterine cancer, there is endometrial cancer, and there's also uterine sarcoma, which occurs in the uterine muscle layer. Endometrial cancer is limited to the endometrium and not in the muscle layer. In the uterus, there are three layers called the endometrium, and myometrium. So cancer that occurs only in the endometrium and not in the muscle layer is called endometrial cancer.
Does uterine cancer have any symptoms at all?
Fortunately, uterine cancer presents the symptoms very early on. Vaginal bleeding is present in more than 90% of all cases. There may be vaginal spotting during periods other than menstruation. So if patients come to the hospital with such symptoms, most are detected at an early stage.
Who is at high risk of uterine cancer?
Since uterine cancer is a female hormone-dependent cancer, the risk of cancer increases when exposed to female hormones a lot. Similar to ovarian cancer, people who start menarche early, who reach menopause late. And then there are those people who use tamoxifen for breast cancer. The use of tamoxifen has been shown to increase the risk of endometrial cancer. And one more thing is that obese and overweight people are more prone to it.
Okay. What is the survival rate of this cancer? Do people tend to die from this cancer?
Since 80% of cases are detected at an early stage, most of them survive. The 5-year survival rate is considered to be more than 90%.
So for hysterectomy, is it effective in curing this cancer?
Yes, it is essential. Hysterectomy for endometrial cancer is a must, like ovarian cancer. Endometrial cancer is also staged throughout surgery, so the staging operation includes hysterectomy. Because it is a hormone-dependent cancer, both ovaries must be resected. So standard practice is to get a hysterectomy and to get both ovaries removed.
So same question as before, is it possible to get pregnant after getting uterine cancer?
Well, it's difficult if you get surgery. Since a hysterectomy is a must, conception is made difficult after surgery. If you want to become pregnant, surgery will not be done, and hormone therapy may be started. Hormone therapy can be done with oral medications, and there is an intrauterine device that releases hormones. The intrauterine device may be used in combination with oral medications, or be used alone. Anyway, after getting hormone treatment and tumor removal, you should get pregnant quickly, and then eventually get a hysterectomy.
This kind of cancer, does it spread fast? And where does it spread, usually?
It is usually detected early on, so it typically doesn't spread outside the uterus. But in the case of stage 3, that is, outside the uterus, it almost seems to behave similarly to ovarian cancer. However, it would be a little difficult to say that it is a fast-growing cancer.
Okay. Is it hereditary?
Recently, there has been a lot of reports on the genetic tendencies of endometrial cancer. For example, Lynch syndrome. The risk of cancer is high for those who have Lynch syndrome. So, Now most genetic tests related to Lynch syndrome are performed in endometrial cancer.
So for endometriosis,
Yeah.
does it cause cancer?
Endometriosis does not cause endometrial cancer. Endometriosis is defined as endometrial tissue traveling outside the endometrium rather than into the endometrium, and they travel to the ovaries the most. So many suspect that it is related to ovarian cancer, but has nothing to do with endometrial cancer.
So for people who have a thick uterine lining, so for these people,
Yeah.
are they more likely to have uterine cancer?
Usually, uterine cancer is first diagnosed because of uterine bleeding, which is the reason why people come to the hospital. They say there is abnormal bleeding, and then we take a look at the ultrasound. Ultrasound measures the thickness of the endometrium, and although it is different before and after menopause, if it is more than 6 millimeters thick after menopause, it's considered to be quite thick. Well, of course, it's not the thickness itself that only matters, but if the endometrium is thickened, a biopsy is performed, and the biopsy can confirm whether it is an endometrial cancer or not.
Oh, okay. So for these kind of myoma fibroids, are they likely to turn into a cancer?
No, usually fibroids, and that's sarcoma, you might be thinking. That's different from endometrial cancer, and the most difficult thing is to distinguish sarcoma from uterine cancers. Fibroids do not turn into sarcoma. Fibroids are fibroids from the beginning, and it is sarcomas that grow like this, not fibroids. It's not that fibroids turn into sarcomas.
Okay. What are these fibroids exactly?
There are several types. The most common way to distinguish them is to categorize them by location. That is, whether it is located outside the muscular layer of the uterus, embedded in the muscle layer, or invading the endometrium. Those that invade the endometrium are called submuscular myomas, and those that are embedded in the muscular layer are called intramural myomas, and those that are outside the uterus are called subseral myomas.
So for these fibroids, what are their biggest risk, or what is their biggest danger, apart from developing into a cancer?
You could say that there is little risk of fibroids turning into cancer. But if its size is very large, or if it grows quickly, you need to check if it's a sarcoma or not. In that case, surgery is required. If it's too large, not only may it be possible that it could be sarcoma, but various symptoms may occur as well. For example, the most common symptom is the need to urinate frequently due to its pressing the bladder, if the fibroid is located in the front side of the uterus.
What are the symptoms, if they have any?
Various symptoms can occur. As I mentioned earlier, if the size is large, it may cause discomfort while urinating by pressing on the bladder or rectum, or make defecating difficult. The most common symptom is, especially in the case of submucosal myoma, an increase in the amount of menstruation and menstrual pain.
Do they affect pregnancy?
Oh, there is some controversy here, but especially in the case of submucosal myoma, it may affect pregnancy.
So can they actually affect infertility, for example? Can they cause infertility?
Yes, it is considered so. So in cases where it is impossible to get pregnant, despite checking all the other infertility factors, like ovarian factors, fallopian factors, and so on, and there happens to be myoma, then many do consider getting a myomectomy, and that's what I typically choose to do too.
So how are they diagnosed at the beginning, and then how are they treated?
In the early stages, when it's not so large, symptoms are rarely present in most cases, so it may not be necessary to do an ultrasound. The most common cases are found while looking at ultrasound for examination. So in such cases, the presence of certain symptoms would indicate an ultrasound exam, and through that ultrasound, a myoma would be found.
So after being completely treated, do they come back again?
Fibroids have a very high chance of reoccurrence, so it should be checked continuously until menopause. Not only does this hold true for those who have had it once, but especially for those who have had multiple fibroids, because for them, they pretty much tend to reoccur 100% for sure. Even if a large one is removed, the chance of reoccurrence is quite high. So you should always think that it can grow again until menopause and get regular checkups.
Is there a certain diet or lifestyle to follow to prevent them?
Well, the exact cause is unknown. So what is have so far is stem cell theory and speculations that is caused by various hormones. But the most obvious fact is that people who reach menopause don't have them anymore. Considering that fibroids do not grow for people who have gone through menopause, hormones may be related to the growth of fibroids. Although many causes of myoma have been identified, but the exact cause has not yet been identified. So the most certain fact is that it is related to female hormones. So it would be better to avoid foods and other things that contain a lot of female hormones. For example, there are pomegranates, aronia, and so on. We think those kinds of foods may have a bad impact on fibroids. In fact, it has not been precisely studied, so we can only say that it's theoretically true.
So what are the most effective treatments for fibroids? For example, I heard about radiofrequency ablation or...
A lot of different choices can be made to avoid surgery. One of them is radiofrequency, and there is also something called HIFU, and etc. Since this does not lead to cancer anyway, you can try such methods to reduce the size of a little bit and relieve the symptoms. In fact, there is no evidence yet as to whether this radiofrequency or HIFU is safe in terms of preventing recurrence for people who want to get pregnant. If you just want to get rid of the symptoms and have no plans of getting pregnant in the future, you may consider such treatment methods. However, for those who are looking forward to getting pregnant, they may have to carefully consider which treatment they should get. Personally, it would be a little difficult for me to recommend a treatment method without solid evidence. Of course, it depends on the size, location of the fibroids, etc. But I think the most reliable treatment method is surgery.
So, Professor, what are the cases when you don't need any treatment?
Well, a typical case would be those who have already reached menopause. After menopause, more fibroids do not grow. Most of them decrease in size little by little. So I do not recommend treatment to people who have reached menopause unless it. For patients with very severe symptoms, surgery may be recommended because they would have already had symptoms even before menopause. We do not recommend treatment for those who have reached menopause. Other than that, in cases where small multiple fibroids are present, surgery would... I've tried removing up to 28 fibroids, but they reoccur 100%, even after complete removal. So if the symptoms are not severe, and if multiple very small fibroids are present, hysterectomy is more recommended over myomectomy if the patient has no plans for further pregnancies.
Thank you so much for your time.
You're welcome.
Today, the doctor explained in detail everything related to uterine cancer, such as its symptoms, how it is diagnosed, and available management for this tumor. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.